Thank you, everyone, for attending today. My name is Michael Mulgrew. I'm the president of the United Federation of Teachers, the Teachers Union of New York City. I'm joined by a lot of people today, but we are here to announce that no New York City school should open unless it meets the criteria, all of the criteria of our school safety report that we are to present to you here today. There is a coalition here of medical experts, parent leaders, citywide political leaders, community leaders, and a national labor leader, all to endorse this report. It is time for New York City to put forth a transparent, clear plan under the guidance of medical experts so that parents and teachers who have been stuck in this fearful dilemma of how to make an informed choice, so that we can tell them what the expectation is for every single school in New York City. It is time that all city schools receive the same support and meet the same criteria so that all children, all teachers, all parents will understand whether their school is ready to open safely in the health challenge that we all face. So I'd like to bring up the graphic now of our school safety report. We're trying to keep it simple, but each one of these categories has a lot of things inside of it. The first thing is the supplies, what happens at the school building, the ventilation, all of the things that we have agreement, most of the things that we have agreement on now with the City of New York, all have to be in place in each and every school. I can announce to you all that the UFT has over 100 trained staff members who are right now, as we speak, are visiting schools to check the conditions in terms of the ventilation, the PPE, the cleaning supplies, and all the other equipment that needs to be in place. If a school has all of those things in place, in terms of that, they get a green check mark. Then after that, we need to make sure that each school has a proper plan, not a bunch of names on a list, that there is a plan for all of the procedures, how children are going in, who's going out, which way they're getting onto their buses and getting to public transportation. We have to make sure that if there is a problem in a school, someone with symptoms, that the procedures are in place, that there is a nurse there, we have an isolation room, that everyone understands their roles, that each school will now have a COVID building response team, that the school will act as a team. If a school meets both of those and gets the green check mark on both of those criteria, it would then move into what we're calling the screening and testing phase, and not before that. In the screening and testing phase is that every single person, both adult and child, who is to enter a New York City public school must have evidence that they do not have the COVID virus. And that means that we are strongly recommending at this point in time for all adults and for all parents to first consider going for an antibody test. The antibody test gives us much more assurance. We would say our position at this point is that we would recognize that test for positive antibodies for 2 months. But if you do not have positive antibodies, then within 10 days of a school opening, that you must go for a COVID test and have a negative result before you will be allowed to enter that school building. Inside of each of these categories, I said there are numerous different things that have to be met, but most importantly, we're trying to keep this simple and transparent for all the parents and the teachers once again. We don't need a hotline to be set up if there is a problem. We want to assure the parents and the teachers that things are already in place before they enter the school. We don't need a hotline to be called if there isn't a person to handle someone with symptoms that are demonstrating COVID-like symptoms inside of a school. We need to make sure that that's in place beforehand. And then once we have all of the screening and testing in place, we then have a baseline. And then at that moment, that New York City must have a rigorous and extensive testing and tracing program, specifically customized for its school system. What happened in March cannot happen again inside of this city. We owe too much to the communities that have suffered so greatly. But we also owe it to them to give them assurances that we're doing everything as a city, a complete community, coming together to say that we are here to support and hold our schools, the most sacred asset of every community, safe. So we are asking the mayor to adopt this school safety report. It is time. It is time. We can no longer have parents and all those who work in schools suffering, trying to make a very difficult decision. And I think we could level or remove part of that anxiety if they see that everyone is working together, because these are not the mayor's schools. They're not my schools. These are the community's schools. And this should be a community responsibility. Parents, teachers, elected officials, all working together to say that we in New York City are doing everything in our power to keep each and every one of our school communities safe. So I'd now like to introduce some of our panelists, coalition folks who are here today. And I want to thank first the medical experts who have helped me and the union throughout this process when we said that we understand that New York City needs to try to open its schools, but at the same time, we have to do everything in our power that we do not start this spread of this virus once again. This city went through hell and came back, and we are not going back to hell because of short-sighted political agendas. So I'd now like to introduce Dr. Jackie Moline, the Vice President of Occupational Medicine and Epidemiology and Prevention at Northwell University, to speak to our plan. Thank you, Doctor, for being here.
Thank you, Michael. It's a pleasure to be here, and I'd like to talk about workplace safety and health. Now, this isn't the first time that we've been involved in school situations where there have been health issues, whether it was tuberculosis, whether it was Operation Clean House with asbestos, whether it was lead in the schools, whether it was dealing with H1N1, dealing with Ebola and concerns for those communities, particularly in Staten Island. Now we have COVID-19. You know, one of the tenets of occupational medicine is its prevention. And the prevention is through a strong plan that has the elements to protect everyone going into a school. Michael said something to me several months ago on a phone call where we were having a conversation with folks from the mayor's office and a number of different health professionals. And he said, we are working to keep clusters of people away from congregating. Yet when we think about opening the schools, we are sending hundreds of people into an enclosed environment. And so we need to think about the safety rigor that has to be in place in order to ensure a safe school for our staff, for the teachers, and anyone who might come in from the community. We talked about making sure that the ventilation is appropriate, and there are guidelines that have been set forth on what needs to be done to make sure that the physical plant is optimal in each school. Making sure there's appropriate PPE. Being in healthcare, of course, we understand the role of PPE and have been dealing with both shortages and the necessity and seeing how it can protect and save lives. We need to ensure that there's an adequate supply and that people are trained in how to use it properly. You can't just throw people masks without making sure that they know how to wear it appropriately and what are the appropriate scenarios for different folks having different levels of personal protective equipment. There also needs to be comprehensive testing and, most importantly, contact tracing to ensure that anyone who may have symptoms are followed up so that the spread might be mitigated in a community. We've seen recently that a rush without a plan, whether it's the University of North Carolina, whether it's Notre Dame, whether it's schools in Indiana that opened and closed the same day, or schools in Georgia, where school children returned to school. There were rates of disease because no one was tested before they went in, and the schools were closed that day. What we need to do is have a comprehensive plan that will cover all the bases so that the schools are safe for our children, for the staff, the teachers, and that we can give the best education to everyone free of fear. Thank you.
Thank you, Dr. Moline. And really, again, thank you for all your assistance. I'd now like to ask Dr. Mark Jarrett, the Deputy Chief Medical Officer for Northwell Health, to address what we are presenting here today. Thank you, Dr. Jarrett.
Thank you for inviting me to be on this panel. We all recognize what happened, as stated before by Michael, in March and April, and certainly on a personal level, in what is a longer professional career than I want to admit, this was the hardest thing I've ever dealt with, and I do not want to go back to those months again in terms of our communities. We all want to open the schools. We are all parents or grandparents and recognize what it means to keep children out of school. Yet this is not just a school issue. This is a public health issue. And I say that because a resurgence that can occur because of this has greater impact outside the school buildings as well as in the school buildings. Clearly, we want to keep our children and our staff safe. There is more and more evidence now. In fact, the WHO said this morning about increasing spread due to people in the ages of 20 to 40 who are asymptomatic and spread the disease. And we certainly know that children may not be symptomatic and spread the disease. So it is not just whether children will catch it, like they all get colds during the fall and the winter. It's the fact that they're going to bring those home. And when they bring it home, it could be to their parents, it could be to their elderly grandparents, and thus spreads from one to the other, and results in, quite frankly, catastrophic illnesses for people who have various comorbidities or elderly or have diabetes and other medical problems. So this goes beyond the four walls of the schools. Clearly, we want to keep, as I said, our staff and our, the staff of the schools as well as the children safe. That is our prime responsibility. But it is also our responsibility to the rest of New York. We do not, nor can we afford another resurgence. We have had such a hard hit in the spring. And if you walk around the city and see how many closed businesses there are, how many people have been hurt economically, this is really tremendous impact on us. And we need to figure out a way to get back to normal, but we don't want to slip further backwards, which will make it even harder. And especially it hurts sometimes the communities that are most vulnerable, which makes it even worse. So I think that coming up with a plan that we all can agree on, that we feel is safe, will never be perfect. There will be spread sometimes in the schools. This is an infectious disease. That's the reality. But to have ways to mitigate that spread, ways to quickly close certain areas, close maybe a classroom or a whole school, and have a methodology in advance, as said by Dr. Moline, so that we're not just trying to figure out what to do when the emergency happens, but to plan for it, because we know what's going to happen. That is really the key in this. And that will hopefully not only allow parents to feel comfortable sending their children to school, allow schools to continue, but also protect the rest of the community in New York City. Thank you.
Thank you so much, Dr. Jarrett. I'd now like to ask Dr. Michael Mulgrew, and I want to thank him also for taking the time to do this and for giving us his guidance. He is the Assistant Professor of Epidemiology at the Harvard School of Public Health. Thank you, Dr. Mulgrew, again for your guidance and for being here today.
Hello, everyone. I'm sorry, we're having a little bit of trouble being able to hear, but just to introduce.
You're fine. We can hear you.
What's up?
We can hear you.
Okay, great. I'm an assistant professor of epidemiology. I generally have been working in the coronavirus sort of response mode since January, February. And I just, in the capacity here, I think that the efforts that are being laid out, they're certainly going to be, these are pretty tremendous times, and there are tremendous activities going on to try to keep the schools safe. And I think throughout this, I'm really happy to take questions that anyone might have, and I can speak towards any of the individual components of the program that are being laid out. But in general, I think that things like antibody testing and getting people tested on a on a routine basis are going to be particularly important to ensure the safety of the schools as they begin to open up. And I'm happy to take questions if there are others as we go along.
Okay, thank you so much, Dr. Minna. We will be doing questions shortly. And now I'd like to ask someone who's been a staunch advocate of the children, especially the special needs children in New York City, one of the leading parent advocates of the city school system. Gloria Corsino is the co-president in the Citywide Council on Special Education. And I thank her again for taking the time to be here today and for endorsing what we are asking the city to now adopt. All right, you're on mute. All right, is it her or us? It's her. Gloria, you have to unmute.
Sorry, I was talking to myself. Good morning. You know, this pandemic, as it has hit everyone else, has affected children of all school age, but children of District 75 is the most vulnerable students, have had the most regression. I am the proud mother of 2 special needs children, and the regression is real. I had shared with Mr. Harmon yesterday that the blessing that I have had with my children's educators, their paras, the staff, has been amazing. My children's educators took it upon themselves after class to come visit my children. They wanted to make sure that my children did not feel abandoned, that they did not feel that they were lost in the system. Their engagement was key to making sure that they needed to see my children as much as my children needed to see them. And that went above and beyond their call or responsibility, and I'm grateful for that. As a parent, it speaks volumes to what we feel. I, like anybody else, wants my children back in the school building. It's essential. It's a need for them. It's a need for everyone. But I also want everyone to be safe, including the people who are educating my children. I would never want to jeopardize anyone's safety, let alone my children. I want the truth like you guys do. I want the staff to have the proper protective equipment, because if they're protected, my children are protected. I want the school buildings to have proper ventilation. I want everything to be in working order before I allow the most precious gifts that I have to walk into any school building. And I think I speak for every parent when I say that. This is not, we're not, you guys and parents are not asking anything that's unreasonable. You're asking for the safety of everyone that has to work collaboratively. And I want to champion that for parents and from this perspective, and we need to work collaboratively so that everyone is safe in that building. I had also offered that I think as stakeholders, we'd love to be part of that walkthrough to make sure that whatever you're saying is not there, we can see as well, and who can better support that than parents who have been educated on what walkthroughs look like. So I'm advocating to be part of that, please. I'm here. Please make sure that we have a seat at the table. We'd like to make sure that we are speaking truth to power with you guys, because it's important for our children. It's important for the staff that work with our children. So please, we are imploring you to include us in that so that we can help you guys.
Thank you, Gloria. And of course, we didn't want to have to ask you to do some of the work we had to, but as always, you are welcome, and we will welcome all the parents who want to work with us to do this work in terms of getting our schools ready. Thank you. I'd now like to bring Randy Weingarten to the microphone, because this really, over the last 2 weeks, it became clear to us that New York City was going down the same path as so many other school districts, and that was the last thing that we wanted to do. And we knew it became more and more of an imperative that we go out and push everyone to understand that parents and teachers do not want what is happening in all of the school districts we're seeing across the country happening here in New York City. And I want to thank her for her leadership in fighting with parents and teachers all across this country. But I also want to thank you for being a friend always to this union and for taking your time today to be here.
Thank you, Michael. And you know, this is part of this new normal where Michael and some of the medical staff are, you know, at the UFT, and so many of us are on Zoom. But I want to actually kind of lead off with how the UFT has been leading in this. As many of you know, I hate sharing screens, so I'll do it this way. We, in April, put together this plan about how to reopen schools, because as Michael said, particularly in New York, no one wanted to repeat the chaos that happened as schools had closed, and the fact that there had been no real national leadership in particular in terms of this whole crisis. The UFT was indispensable in putting this plan together. The UFT has been working since April on trying to figure out how to reopen schools, how to do something in a way that really worked, as our amazing parent just said, that would really work for children, would work for educators. And frankly, before all of the resurgence of the disease, we could see around the country that 75% of our members said, if we could get the safety standards that Mike Mulgrew and the UFT had as part of that report card, they would be comfortable going back into school. Well, we know what happened since. The mishandling continued. Donald Trump decided to throw a wrench into all of the planning and failed to do any of the work in terms of resources. And now what you're seeing is over 60% in a Peterson poll today, not one you would call a liberal poll. In a Peterson poll today, over 60% of parents and teachers say that they were very concerned about school reopenings because of, as Michael said, what has happened in the last few weeks. And over 81% of parents and the public, and you can see this throughout, it's Democrats, it's Republicans, it's independents, it's people of color and people who are white. It is almost unanimous in the United States that 81% of the people say we need to actually make sure that we can keep things safe. That is more important than reopening anything. So what do we do in this situation? That's why what the UFT has proposed here right now is so important and so profound. They have three basic issues here. One, obviously, was the community, the community spread, which Governor Cuomo and others have talked about. Two is this safety report card, which others have talked about. But third is this point that the doctors and Michael Mulgrew and others have talked about today, which is so important, that kind of robust testing, tracing, and isolation situation. Because without it, even if you open, how do you stay open? That's what just happened in terms of the University of North Carolina. That's what just happened in terms of Notre Dame. So you have to have a system that actually, particularly given that this disease is so asymptomatic and spreads so asymptomatically, as the doctors have just said, you have to have a system where we can actually see and know the data, see and know who is infected and who is not infected. And if you don't do that, you will never know until it's too late. And then when it's too late, it becomes a little outbreak, becomes a surge, as we have seen in the South and the Southwest. Is this my opinion? No. I'm a social studies teacher and a lawyer. I listen to experts. I listen to the experts that are on the phone that are at the UFT, the doctors that are there. I also look at evidence. And if you look at South Korea, you see that evidence. We could say we shoulda, coulda. This is going to be an issue in terms of the election about whether or not Donald Trump mishandled this. I believe he has. I believe the voters will see that. But right now, it's not, it is what it is. It is what we need to do about it right now to ensure that we can educate children and keep people safe. And that requires that kind of testing, tracing system. That is exactly what South Korea did. And yes, when they have when they have some outbreak, as the doctors have said, this is not risk-free. What they do is they can handle it because they have this kind of robust testing, tracing, and surveillance system. Does this cost money? Yes, it costs money. And if LA can figure out how to find the money to do it, New York City can figure out how to find the money to do it. It's not about having a hotline. It's about following the science. So if it's important to open schools, we have to do it gradually, we have to do it responsibly, we have to do it safely, and we have to have this kind of testing, tracing, and isolation process that Michael and the UFT has proposed. I applaud them for doing this. It is state of the art, and it is the only way we are going to be able to be safe and educate children. Thank you, Michael.
Thank you, Randy, very much. I'd now like to ask a person who first and foremost is a New York City public school parent, but is also in his role as controller of New York City, gets to look at both sides, gets to see it from the viewpoint of the parent, as well as someone who understands what the community is truly crying out for in terms of transparency and a real plan. I'd like to bring Scott Stringer up to the microphone.
Thank you very much, Michael. For the last several weeks, I've had the opportunity to hear from parents across the city via Zoom conference, virtual town hall meetings, with parents who are worried about their kids and the safety of our schools this fall. Parents who are frontline workers, parents with pre-existing health conditions, parents who are desperate to know whether their kids will be kept healthy and safe. And that's the first question I hear from parents. Is it safe? And more importantly, can we make it safe? And right now, those questions had remained unanswered. We've said that we need clarity and creativity from City Hall, but City Hall hasn't stepped up to the plate. And the reality is we have been waiting for these answers for too long. With just weeks to go to open schools, we need to have a plan. And we need to have a plan that we can all get behind. Today, the UFT Mike Mulgrew plan is a real roadmap to safety, with testing and protocols and actual people on the ground to keep our kids safe. We know the challenges that teachers face. They've risked their lives in the midst of this pandemic. They're frontline workers, and they love our kids more than anything. And right now, I really wish a chancellor and a mayor were here today announcing this plan. But the fact that all the advocates, Speaker Johnson and so many others, are joined together to say, let's give this plan a shot. Let's really take it to the powerful interests and say once and for all, we care about our kids' safety, we care about parents, we care about teachers. And I'm very excited because as a parent of a public school kids, a third grader to be and a second grader to be, I worry about this every day. Can the most precious people in my life be safe? And I've thought a lot about this plan, and I've talked a lot with the UFT about this plan. And I am hopeful that we can adopt something this rigorous to give our kids an education they deserve, to fight this pandemic. So I just want to say to Randy Weingarten, to the health experts, to Michael, who I know has had many sleepless nights putting this plan together, we need to get City Hall to step up right now, to give us clarity, to give us the plan, to take the best of your science and health and make a difference right now. I'm really proud to be here today with all of you, proud to be here with Michael and the UFT and all the stakeholders who care so much about our precious kids. Thank you.
Thank you very much, Scott. I now like to bring up someone who's been a staunch supporter of our schools and has led us through some really treacherous times recently with all of the financial problems the city is now facing, the funding shortages that the school system is facing. All of these things fall squarely onto this man's shoulders. So I'd like to have Corey Johnson address all of us here today. Thank you, Corey, for being here, and thank you for being a leader in these tough times.
Thank you, Michael. I think you just called on me. I'm having a little bit of a hard time hearing you, but thank you. Good morning, everyone. I'm Corey Johnson, Speaker of the New York City Council, and I'm really honored to join this group this morning to talk about what is going to happen in the next few weeks for New York City schools and for the 1.1 million children who rely on our schools and the amazing teachers that teach every single day and that had a really arduous final few months of last school year at the height of COVID-19 in New York City. I want to thank UFT President Michael Mulgrew for organizing this and bringing us together. Michael has been a leader on countless critical issues throughout our city, especially during this really challenging time for our students, teachers, and families. He understands that we rise and fall together. And the UFT understands that when we talk about schools, we're not just talking about teachers and students alone. We're talking about the entire school community, custodians and cafeteria workers, parents and grandparents and siblings. And this is why the safety reviews and testing protocols that have been put forth by the UFT, by medical experts that are on this panel today, and by parent and community groups are so important. We know that back in March, there were mistakes that were made, and I don't pin that on anyone, but there were mistakes that were made. We just have to make sure that we do not repeat some of those mistakes that happened back in March. Schools needed to be closed, but the advice of experts were not always done with urgent action or were sometimes delayed. And we know that COVID-19 was already circulating throughout our schools at that time. Countless teachers and staff and students and their family members were exposed. And we have to make sure that nothing reckless happens moving forward. The sounds of nonstop ambulance sirens are still too fresh in the minds of many New Yorkers. And we have done a good job as a city collectively at keeping our numbers low over the last many months. We have to make sure we continue to do that. We cannot ignore those hard-won lessons, so we have to make sure we do this safely. Safety must come first, and that means delaying in-person schooling until appropriate safety measures are not just talked about, but are actually implemented. I just want to end by saying that the UFT and also the Principals Union and so many of the parent leaders and the folks that have been on this call today want school to open. We are not saying do not open school. We are saying let's make sure we do it safely and smartly. It is deeply upsetting, honestly, that so many children have not been able to be connected with their school communities and with their peers over the last few months of school, but we know that it was done for safety reasons. And what we needed to be doing over the last many months since schools closed down in March is to come up with an individual plan for every single individual school building in New York City to give parents peace of mind, to give teachers peace of mind, to give those school communities peace of mind. And so much of this revolves around rapid testing protocols for the entire school community to make sure that the ventilation systems are working appropriately throughout those schools, that social distancing is possible. I know the Comptroller Stringer has been talking about outdoor spaces during the warm months in schoolyards and other places to be able to have more adequate space for children. So this is the work that we know will allow us to open up our schools safely and effectively. This is about getting to a place to open the schools, not about throwing up obstacles. No one is looking to throw up obstacles. We are looking to be able to do this safely, to give people peace of mind, and to make sure that everyone is safe. Children and students, teachers, custodians, cafeteria workers, principals, assistant principals, paras, everyone who is in a school We want them to be safe. So I want to thank you, Michael, for the hard work you've put into this plan. I want to thank Randy Weingarten for her national leadership on this every single day, talking about what's happening all across the country. And my hope is that New York City will be a model. We will be the model for the rest of the country to show folks that we can do this safely. We can have social distancing. We can make sure that we are listening to the input of school communities and to the workforce. So I want to thank you, Michael. Thanks for having me today. I look forward to continuing to support the safety around this plan by listening to experts who are weighing in and telling us how to do that. And with that, I turn it back to you.
Thank you very much, Corey. We appreciate the kind words. And I'm now going to ask each of our three community leaders, but please don't thank me. This is all of us together. This is really hard stuff. And I appreciate and I thank you all for taking part of this process right now. So I want to bring up someone who has always stood by the parents and the teachers and all the communities of New York City and been a fierce fighter, fierce, and has always said that the public schools are the most important commodity of our city. I want to bring to you, I would like the president of the NAACP New York State Conference, Ms. Hazel Dukes, to address us. Thank you, Hazel, for taking time and being here.
Thank you very much. Can you hear me?
Yes, we can.
Thank you very much. And I am absolutely honored to join with so many of my friends. And let me give a real shout out to the speaker, Corey Johnson, and the city council members, Denise Miller, who assisted NAACP in this trying time of making sure that some of our children that had not had the resources they need, especially the computers and tablets, for what they did for us with discretionary funds this year. So thank you again, Speaker Johnson. Let me say to Randy Weingarten, my sister, and to Michael, we have worked on so many issues on education through the years. We've had our difference of opinion, but our focus have always been our children. Several months ago, Anthony Harmon, who's one of the presidents of the 15 branches we have throughout New York City in every borough, we came together and we put together a NAACP education task force that was at the end of March. And we looked at and had parents calling the office, and we put a proposal together. We submitted it to the governor of the state of New York and to the mayor and the chancellor. I am so disappointed to report we have never received an acknowledgement of the proposal that we submitted that was thorough. It started with health. It started with the resources, all they need. We have never had an acknowledgement from the mayor or the chancellor of the city of New York. We've heard from Dan Fuller at the state level. We've heard from Commissioner Rosa. And so today I come on behalf of the 15 branches in New York City opposing anything that the mayor would say about opening our schools. He have not presented a plan to this community and to our parents. Survey is full of junk. We don't do surveys well. And so today I join here saying that the plan that we have put together, Michael Mulgrew have looked at our plan and reviewed. We didn't say it was the best thing since sliced bread, but we are saying we are offering something. So sit at the table with us, as the parents say, include us. We represent. We are in every community. We are in the New York City Housing Authority. We are there. We talk to people. We hear them. There are too many unanswered questions for us to say that we are going to open New York City schools. We will not, because if we open them on a Monday, I guarantee you on Monday afternoon, we are saying we're closing up. So I joined today. I heard the medical experts, which is great. I've heard from the elected officials. I've heard from the parents. Now it's time for the mayor and the chancellor to hear from us before they make a decision on opening schools. You're right. We all want our children back in school. We're all concerned about the education of our children. When we think about the kids who are in foster care, we think about the kids with disabilities, when we think about the kids who are in the shelters, there are too many unanswered questions on the safety, on the health, and the learning of our children that we can support opening New York City schools. I am not happy with remote learning. There are a myriad of problems there. I don't know whether they have been corrected because we don't have any answers. We have no data to say what the mayor get on TV and say every morning. That's not good enough for me. I'm intelligent. When Randy can show her proposal, when the UFT can show theirs, and the NAACP can show theirs with data, with hard facts, then we deserve as New Yorkers for the mayor and the chancellor to do the same to all of us. So thank you for inviting me to participate. And I'm here to support our children, our workers, our teachers, our custodian, our cafeteria workers, all the people that make up for quality and good education for our children.
Thank you, Hazel Dukes. As always, you just make sure everybody understands exactly what is going on. So I do appreciate it. And I want to be clear before we get to our last two speakers. There is so much more the school system still has to do, but we can't, for the mayor or the chancellor or anyone to be talking about all of the other things that have to be done without first addressing the safety issue. That is why we are having nothing but chaos out in the schools at this moment. Principals have received very little instruction, no clear directions, have been sent surveys to send to the state. We still don't have a program in place to make sure that every single child will be remotely hooked up, because no matter what we do this year, every child will have a portion of their instruction will be done remotely. And all of that, we have no plan in place for all of those things, but we can't do any of that until we first have an assurance of safety. And then making sure that all of those children, there has to be inventories at each and every school, that every child has translation services or assistive devices in case of their disabilities or the challenges they face here in the city. All of that is standing still because we still haven't solved the safety issue. So I'd like to bring up the executive director of the New York Immigration Coalition and thank him for being here, Mr. Stephen Choi.
Thank you, Mike. And I just want to say how honored I am to be standing with such amazing champions and allies from across the field. I stand here today because we are in a period where New York's immigrant communities have been devastated by this pandemic. Immigrant families have been hit so hard by COVID-19. Immigrant neighborhoods have seen so much of the death and illness that COVID has wrought upon New York City. There are thousands of people in our communities, in immigrant communities, who have died. Tens of thousands who've gotten sick. So we absolutely need to be mindful of the health and safety of the city's immigrant communities. Also, immigrant kids and immigrant families in our school system have been so disadvantaged in this moment. And we're not just talking about some kids. This is most New York City kids. Nearly half of New York City students speak a language other than English at home. So we're talking about millions of students and millions of immigrant families. And those kids deserve a shot, an equal shot at a quality education in a safe environment. And so we need to be thinking about all the challenges in the situation, not only by parents and families potentially getting sick and dying, but also by the challenges of the situation. The achievement gap between kids is threatening to yawn even wider. And so I want to be clear. I want to join Hazel. I want to join so many other people. We're all aligned on this call because we all want schools to be open. We want them to be open as soon as possible and as soon as practical. Immigrant kids have been affected deeply and negatively by this period of remote learning. The achievement gap is getting bigger. And so many immigrant families don't have a child care safety net during the day. More than half of our frontline essential workers are immigrant New Yorkers. But we are all aligned today. We join with our allies to say we must do more. We have to do more before schools reopen. We need to make sure that all of our key elements are actually in place. And we love the plan that Mike is putting out there to make sure that immigrant families and youth, that teachers, school leaders, and staff are safe, and that everyone feels prepared going back to school. And we just don't have that right now. And I just want to highlight another piece. Another part of ensuring real safety and being prepared to open is having a system that's in place that is quick and efficient to get information out to immigrant communities, out to immigrant families in their home language. They need to be informed as soon as other parents are informed, and that is not happening. And we need to also make sure that input from immigrant families is going into the system as well. Throughout the pandemic, there's been a major challenge getting immigrant families information. How are you going to make schools safe for immigrant families if you're not getting information out to them and you're not hearing from them? The digital divide and language access barriers have led to so much confusion among immigrant families. And so communication by the DOE, by the city to immigrant families, hearing that back from them, that's a critical part of any safety plan. And the city just needs to do more. We've had some progress. I think everybody will tell you here on this call, we've had some progress, but the city needs to do more. And we're at a critical moment right now. So we are proud to join with our allies. We're proud to join with our champions, proud to join with the UFT in delivering this message to Mayor de Blasio and to Chancellor Carranza. We need to do more before we actually do this. Thank you.
Thank you so much, Stephen. I really do appreciate it. To Reverend Foy, I'm sorry, but I kept you to last on purpose because I thought it was important. And at this point in time, I'm ready to do anything that needs to be done to keep our children safe. So the organization, the Arc of Justice, which you have founded, but more importantly, I'm trying to do anything that could help us. So if you can bring the good Lord to apply to bring some wisdom on people in this city and help us try to get through this endeavor, I would have greatly appreciated it. I know it's inappropriate probably for me to ask you to do that in a public setting, but I want to thank you for what you've been doing here across the city, but more importantly for being here today. Thank you so much, Reverend Foy.
Well, I want to thank you, Mike, for your exceptional leadership in this very trying time. You know, our teachers have always been a source, a resource, not just an educational resource, but an emotional resource and a moral resource. I remember tragedy after tragedy where the teachers were on the front lines, comforting our fallen and comforting survivors. I remember marching with Randy after the Pulse massacre. I remember marching with you, Mike. I remember the teachers joining hand in hand with the community in every crisis that we faced. And as always, we face another crisis and our teachers are stepping up in the absence of real clear vision and leadership coming out of City Hall. Our mayor was elected promising to end the tale of two cities. And here he has given us a tale of two school systems. It is unacceptable to ask that our essential workers put their children on the front lines with no plan, sending their kids to schools with no plan, sending their children into harm's way with no confidence that the city is prepared to protect them and provide a secure and safe environment. I'm grateful that you and the UFT have stepped up and provided a plan that parents can be confident in. I'm not just an activist, I'm a parent of two public school kids, grade school kids. And quite frankly, my wife and I have decided we're not prepared to send our children back into those school buildings. And it's not because we don't trust the staff or we don't trust our teachers, but there is no trust in the leadership. In the absence of a real plan, we cannot sacrifice our children or put them on a coronavirus yo-yo. We can't ask our kids to get ready to go back into an environment that they have been missing and longing for, only to have that rug ripped out from under them prematurely because we didn't plan. And now we have to shut the schools down again sooner than we had hoped. The UFT has provided a plan that parents can be confident in. If we, as a city, can come together and set ego aside, if we can come together and put public health above economics, then we can pull together. We can provide our students with the education that they are in need of and deserve. We can provide our teachers and our professional educators with the environment, the safety that they deserve. We cannot afford to lose another teacher. We cannot afford to lose any more students. There are still very many unanswered questions about how this virus impacts young people. And so we cannot turn our schools into biological research facilities where we are asking our children to expose themselves to dangers that we can't measure at this time. It is time for us to take a step back, as your plan calls for. It is time for us to assess where we are, building by building, facility by facility. It is time to instill in the parents the confidence that they need, to encourage the parents with data and with a confident plan of action should an outbreak occur, should a child or a professional come back positive, that this situation won't balloon out of control. These are questions that parents have. They're concerns that they have, and they are not concerns and questions that have been answered by City Hall. But yet, once again, our teachers have stepped up. And as a parent, I say thank you. As a father and a husband, I say thank you to our teachers for what you have done, for the remarkable job that you did transitioning into remote learning. It wasn't perfect, but the intent was there, the will was there, and the commitment of our teachers was there, and I'm grateful for it. I would just close on this one last point. COVID has quite clearly impacted communities of color in a disproportionate manner. We need to make sure that does not bear true for our children, where we have asked the essential workers of our city, the people of color of our city, to bear the heaviest burdens of COVID. And now we're going to ask their children to bear the heaviest burdens in the name of ego play, in the name of economic expediency. It's not going to happen on our watch. I'm grateful for your leadership. We are prepared to do whatever is necessary to ensure that the city reopen schools under nothing less than the safest conditions humanly possible. And that's not going to happen absent the implementation of the UFT plan. So we're with you, Brother Mike. We're with you all the way. We're with you, Randy. We're together in this. If we're not going to reopen our schools safely and securely for all of our students, we're not going to reopen our schools safely and securely for anyone. And the mayor needs to understand the resolve of the UFT. They need to understand the resolve of the civil rights community and the activist community. But most important, they need to understand the resolve of the parents of the 1.1 million students in the New York City school system. We're not going to let you play politics with our children. We draw the line of political games and gamesmanship and brinksmanship. We draw the line around our children. It's a bright red line, Mr. Mayor, and you're going to respect it. Either you're going to respect it through force of our will, or you're going to respect it through reason and rationality. But one way or another, Mr. Mayor, you are going to respect the will of our parents and our educators as we protect our children from what has been the most devastating and traumatic time in modern American history. And we're not going to allow ego and political expediency to inflict further trauma on our teachers, our educators, and indeed our children.
Thank you, Reverend Foy. Appreciate the strong words and all of the support on behalf of the teachers of New York City. So we're now going to start our question period. And before I take a first question, I will answer one that I know I'm definitely going to get. If we feel that a school is not safe, we are prepared to go to court and to take a job action. And if a court deems that we are breaking the Taylor law, so be it. We will deal with the ramifications of it. We have promised the teachers and the parents of New York City that we would stand and fight if we felt a school was unsafe. And that is a promise we are going to keep. If whatever happens because of us, that resolve will not be broken. That means we have to deal with all of the different issues of the Taylor law in the courts. Again, so be it. But we have made that promise, and that is a sacred promise, and we will not allow that promise to be broken. So everyone has to understand that unless that school passes that school safety report, our position is clear. The school should remain in remote-only operation. No one should enter the building and put themselves and their families at risk. So I've made that clear. I'll do Marcia first and then here.
Michael, as I understand your plan, you would like every teacher, every principal, every adult, and every child to be tested for COVID 10 days before the school opens.
Or have an antibody test, which would give them at least 2 months that we would recognize.
So given the fact that there are, by my count, 1.1 million students, 75,000 teachers, and thousands of principals and cafeteria workers and custodians, how is it physically possible for that to happen and schools to open on September 10th?
Well, we don't believe it is possible for schools to open on September 10th. And take the testing piece out of it. Even without the testing piece, it is our judgment at this point, as well as the principals union, that if you open schools on September 10th, it might be one of the biggest debacles in the history of the city.
And if I could just follow up.
Sure.
The amount of testing that you're calling for is massive.
Mm-hmm.
And do you think that at this point, New York City has the capacity to do that expeditiously and also continue to do it sporadically during the school year to try to find out if there are any clusters that might develop?
I believe with all of our private partners and as well as the city that we could develop a plan. The key here is we're not saying every school has to open on the same day. Remember, in our plan, the school has to first meet the first 2 criteria. Is all the PPE loaded into the building? Is all the signage up? Is the ventilation system up and running properly? Is there a plan in place for each of the staff that will be returning? Remember, we also have a major staffing challenge ahead of us. Of all of those, a school should not move forward with the testing process until it first has those 2 things in place, the procedures and all of the supplies. If you're telling me that New York City is going to make sure that every school in New York City has those first 2 things in place all at the same time, I don't believe it. So there's clearly a way to come up with a plan, working with the parents, being transparent about this, but getting everyone together to say, this is parents and teachers and medical professionals all working together. It's not time, and this is what's driven me nuts in the national debate. It's everywhere they go to open a school, they try to pit people in the community, parents against teachers, elected officials against union representatives, where at this point in time, the exact opposite should be what any elected official is pushing for. Everyone wants their schools open, but we don't want them open if they're not safe. So there's clearly a path to develop this will of New York City. The business community tells us they want the city schools open right away. And if we say, well, if you want them open right away, are you willing to chip in? Are you willing to help? I could talk to, bring it to the medical experts who are here. This is clearly something we have thought through. We know there is no way at this point in time for the city to test everyone in a 10-day period, but you're also talking about, we've already had almost 300,000 children opt out of live instruction at this point in time, and antibody tests can be done right now. right now. And for some reason, some twisted reason, and I'm going to go to the doctors in a moment, we seem to have much better access to antibody tests than we do COVID tests. But I'll throw it over to.
Well, antibody tests are just a blood draw, which obviously for a child is not the most pleasant thing, but the nasal swab for the PCR testing also, is uncomfortable. But I think we have more capacity for antibody testing now than we can for doing huge numbers of PCR nasal swabs. It's a blood test. And although the CDC has waffled back and forth about what it really means in terms of immunity, it is certainly not the perfect measure right now, but clearly if someone has a history of COVID and now has antibodies, it's probably safer to use that than saying, I'm swabbing you today, and then are you safe a week from now? Because a swab only tells you at that moment you don't have the disease. So we have to parlay both together and use what we can, remembering that only, depending on the community, it can range from 10 to 20 to 30% may have antibodies already, and some communities had very high prevalence of disease, such as Queens.
Do you accept either the antibody test or the swab for COVID?
Yes.
Yes, that's why we're saying we can do a lot right now, but we need the city to adopt this plan. And it's highly recommended, as the medical professionals have, which I've been telling our membership since I've started this process, that the doctors have clearly said to me that it's really important for people, especially in a place like New York City, to have that antibody test for their own medical knowledge.
You want to see the start of school pushed back from September 10th? Do you want to see remote only September 10th, or something different? And do you foresee different schools opening on different days?
The plan we're presenting would actually says, unless the city can say it can get everything done by a certain date, then it would just be impossible to open the schools on September 10th. There was a reason why in the beginning of April, we asked City Hall to start engaging in a process for a plan to open schools. If you want to go back and look, I do remember penning quite a few op-eds and going on many of your shows saying we need to start planning now. It's not, we knew there was a fatal judgment when City Hall decided not to start engaging in a plan for opening schools until July. And because the size of our school system and everything that it entails, in a regular school year, we start our planning in April. This is not a regular school year. Clearly, we have to deal with a pandemic. We have to deal with, at this moment, more than 70% of the instruction has to be coordinated between an in-person teacher and a remote teacher. Every student has to have all of their digital devices working. So just imagine this challenge, which is why we were screaming in April and then in May. And then at that point, it just became so frustrating because the mayor at that point just kept saying, we have plenty of time. Last week, he said we have plenty of time. I don't know what he's talking about. We do not have plenty of time. There's been an expediency since April. So if we can't have these things in place, then no, the school system should not start on September 10th. If by some miracle, they can get everything done by September 10th, if they meet the criteria of this report, the beauty of this report is that everyone gets to see what has to be done. The parents get to see it, the teachers get to see it, everyone sees exactly what has to be in place. If these things are in place, you can move forward. If one of these things is missing, you cannot move forward.
Even if it's remotely, you would prefer a delay. You would prefer a delay.
Without these safety procedures in place, we have to, then we would prefer a remote delay.
A remote, nothing starts September 10th.
If there's a school, I'm going to keep saying this. I can't call for a specific date when I'm saying if a school meets this criteria, they should move forward. Overall, it's my judgment that most schools, if any schools, will not be ready on September 10th.
It sounds like it's safe to say you're going to be in court September 10th. Is that fair?
That really depends on the mayor and whether he's willing to adopt this plan and say that this is what we're all agreeing on that needs to be done so for the sake of the parents and all the communities to move forward. But again, the issue for us, the thing that will drive us to court or a job action is if the mayor tries to force schools to open when they are unsafe.
Have you presented the plan formally yet to the administration?
I have discussed all elements with this plan with this administration.
They've been, what was their reaction?
I'm waiting for them to get back to me.
Is there a plan that we can see and read that lays this out?
We will send you all of the elements of each one of these things, and then how the major piece here is on the building, the facilities piece. We have a complete list of things that are to be checked. We have over 100 people who are trained, and actually we have people in the schools today. We had people in the schools last week doing these walkthroughs, doing these checks. Once they have all of those things in place at the school level in terms of the physical plant, then it really comes down to the procedures and the school's plans. Those are definitely lacking at this moment. The PPE loading and school cleaning loading is starting at this point, but the problem is we should have started loading the schools in July, not in the middle of August.
And just to follow up on that, some of what you're asking for, it seems completely impossible that the city will be able to deliver in terms of the testing. We know what the testing capacity is. At what point what's the deadline for deciding whether you go to?
I believe when the mayor decides to force anyone into an unsafe situation is when we go. I'm gonna make this clear, so I don't have to get the question. The minute we feel that the mayor is trying to force people into a situation that is unsafe, we go. We go to court, we go to job action. That's where we go. But I'm going to say this again, in terms of the testing, there is no issues with focusing on when schools are ready, whether it be by district or grade level, to do the screening. Just think about this right now. If we screen every adult and child, whether it's the antibody test or the COVID test, and we have evidence that they're walking into school on the first day that it is open without COVID, how many instances of asymptomatic spread are we stopping? If we don't do that, we're going to have the same stories that we're seeing in Georgia, in Florida, in Mississippi. You will see the same stories here in New York City. So we're not saying every school opens on the same day. We're saying make a plan, talk to the parents, discuss this with the parents, make sure they all understand what we're trying to do is in the inch so that we want to keep their children and their families safe, and we can all do this together. And under that type of plan, we have the capacity to do the testing and the screening.
And then just, I'm unclear on this. So let's say a student doesn't have antibodies. So as far as
So they need the COVID test within 10 days of walking into the building.
But then when do they get retested? Because they could get COVID 11 days later.
So then at that point, once we have these issues in place, the whole idea is to minimize the risk of spread. Yes, nothing is perfect, but this plan is much more comprehensive than what we've seen in any other school system. Once that is in place, and now I'll go to the doctors, it's a very rigorous testing and tracing program has to go into place. Intermittent random testing. I'm going to turn it over to each of the doctors who can speak to this, because this is a very big concern of all the medical professionals we have spoken to.
We've certainly talked to the city about doing testing of all the staff and doing that on a monthly basis so that you're getting a sense of asymptomatic or pre-symptomatic spread within each school so that all staff would be tested on a monthly basis unless they have antibodies. And so there are ways of doing it, whether it's alphabetical, whether it's by some other means of doing it, so that you get a true sense of what may be going on in each individual school, but not just doing it once to get that one point in time, but continuing to have monthly testing so that you will pick up where there might be an early cluster and understand that we better begin the contact tracing if there's asymptomatic positive results.
Test every teacher once a month. How often do you want to test the kids?
They would have to be part of the random testing also. So each school community would have to be part of random testing as long as we have COVID in our city.
You would say that every student would get tested once a month as well?
What I would say is that we need to a percentage of people at each school, right, both adult and student would have to be tested in a random monthly intermittent testing. Dr. Minna, do you want to comment on this? If you could hear what we were saying.
I wasn't really able to hear the question, but do you want to just briefly
It's about the intermittent random testing after we establish a baseline by screening everyone, and why that would be so important and what that would entail.
Yeah, sorry, it was still a little bit difficult, but I think the intermittent screening, to really keep our schools safe, we're going to, I mean, there's no way around it. This is going to be a massive undertaking. It's going to be a very, very difficult thing. I think what is being proposed here is one of the most aggressive strategies, for sure, for a large school system, but it's also needed. There's no question about that. I think having testing along the way is going to continue to be needed as well. I'm a proponent of much more frequent testing, but that's at the moment in this country not actually really very possible to have extremely frequent testing. And so intermittent testing, ensuring that we're monitoring the school systems, we're keeping track of where cases might be emerging. This is going to be absolutely critical to keep students safe. And this is a virus that I think we all know at this point spreads very quickly. There's just no way around it at this point to think anything different. And you know, I agree completely that if these plans and processes are not in place before September 10th or whichever day the school system really starts, it is a very risky endeavor to open the schools. As much as I recognize the absolute urgency and need to get them open, these plans need to be put in place, and we have to not just have the plan for the first day, but there needs to be a plan continuing throughout the fall. This is additionally a very, very seasonal virus, and so what we're seeing today and the type of transmission that we're seeing today might be just a glimpse of what's to come in November. For example, or October, where these viruses normally shoot up and we get coronavirus peaks usually in the fall. All of this points to this intense need to ensure that testing is widely available, and I think that there's no reasonable argument at this point that somebody should be going to schools, perhaps not participating in these testing programs. It's just in some ways, it's just too important to keep the population safe.
I'll just make one other comment. I'm sorry. And it's not just testing in a vacuum. Thank you. It's not just testing in a vacuum of the schools, but one has to also look at what's going on in the communities around those schools, and we will know what rates are doing in terms of upticks in certain communities, as we've had over the last couple of weeks in a few communities, and that might prompt more intensive testing, not just continuing. You have to have a flexible plan that reacts to things going on in the rest of the environment. So it's not that the whole city has to go up to a certain percentage. It may be even on a community basis. So that has to parlay into the testing routines as well.
Okay.
Excuse me?
Yes.
So I'm just wondering, you guys keep pointing out there's not enough guidelines to guide the schools to reopen safely, right? So I'm just wondering if you could specifically point out what's wrong with the current guidelines. And also address, like, you know, as far as I'm concerned right now, the hybrid model is letting the parents choose whether or not they feel it's safe personally. So it seems to be more of a personal choice for the parents, right? So I'm just wondering also, do you think that there could be some like middle ground where maybe you could some way ask teachers if, because not everybody's from the same mold, right? There are some teachers who do feel safe going back. There are some that don't, of course. Mm-hmm. So just wondering if there's any middle ground, kind of treating it in a similar way, if there's any compromise.
So in terms of the current guidelines, what was submitted to the state by each school was a survey that was sent by the Department of Ed. We're the only school district that submitted surveys as our individual school plans. And there was no real instructions given to the principals of New York City, but you can talk to their union about it in terms of all of the different things and procedures that a school itself is going to have to do. And when it comes to a personal choice, the reality is that a lot of our teachers and a lot of our parents, that choice really is, do I go to work or do I send my child, versus do I have to stay home because I'm on my own version of childcare, or as a teacher, I have to stay home because I don't feel safe in what is being done inside of my school. You're then talking about families and communities being put in a position of safety versus their own ability to have a home, to take care of their family. And that's the reality for a lot of New Yorkers right now. So we can say it's a personal choice, but personal choices really look differently depending on the circumstances of an individual family or the individual person. So some people really don't have a choice. And that is why, in July, because after running a 6-week campaign saying we're having a child care crisis in New York City no matter what we do, the mayor announced that he had a child care plan for 100,000 seats. I haven't heard him speak about it since. So there are real hard choices that people are sitting in their homes. And these are choices that are wrought with fear and anxiety that they have to make. And what we're trying to do here, all of the people here who came together today, is we're trying to remove some of that fear and lower that anxiety to some way to say, we are telling you, we're trying to do things all together that will give you a better assurance that you can be safe to go to a school to teach, that your child will be safe if they come into this school. They'll be better off now if we do it this way versus the way that we're headed right now, which is nobody has any degree of assurance about safety inside of our schools.
Just a follow-up question. So what about the social distancing measures? I mean, briefly, they have there'll be less capacity, right, of students. So, I mean, and this may be a question for the doctors. If what is the risk? I mean, you're saying right now we don't have the proper testing capacity and PPE, right? So why is it still extremely, from what you guys are saying, extremely unsafe to send students back even with proper social distancing measures and lower capacity in the buildings?
Have you ever been in a classroom with a bunch of kids? I mean, the reality is social distancing with young children is a challenge. Keeping masks on as adults is a challenge, but think about it with the younger kids is a challenge. So PPE is not the first line ever. You want to make sure that it's a protection, but you want to make sure that people don't have the disease first, and then you use the PPE as a secondary measure rather than relying on it as the sole measure. Unfortunately, we've fallen into this, you must have the social distancing and PPE, because we haven't had what we should be having, which is the widespread testing, so that we truly understood what disease people had. But that's why there's advocating for making sure people at least have an understanding of whether they have the disease now, whether they had it in the past. And then it's critical to use the PPE as well. I'm absolutely advocating for the social distancing and the PPE as well, but it can't be the be all and end all without understanding that it's important to have rigorous tracing, testing and contact tracing to identify where it may have spread.
Yep, over here. Allison, just let me know when you have to go to the online folks.
Let's go back to choice and making decisions. When it comes to the city, if they don't adopt the plan and teachers don't feel safe going back, what are you going to be recommending apart from going to court?
If we'll go to court, as I said before I took questions, we will go to court. And if need be, we will start doing job actions to make sure that everyone is safe. We are not telling people to go back to work. We will be informing parents as well as our members that the building, we cannot deem that building is safe for them to enter without these things, the things that they are missing. So I hope I had covered that right in the beginning. I don't know how else to say it any more explicitly.
How long ago did you present this plan to the mayor? Was it yesterday or a couple of days ago?
It was sometime last week.
Still waiting.
Still waiting.
My question is for the doctors. Have you guys taken account in your plan about AFM, which the CDC is going to be a problem in September, and also about multi-system inflammatory disease in children outbreaking during this time too, that could be going rampant with COVID-19?
That's definitely for you guys.
I'm sorry, what was the first part, the AFM?
AFM, which is acute flaccid myelitis, which you're saying that there was an outbreak in 2018. The CDC is saying that in September, they're seeing a trend. I was on a conference call with Dr. Redfield, and he was talking about how that's going to be challenging with COVID-19. And also you have multi and systemic inflammatory disease in children that runs rapid too. So does your plan account for that?
The plan really, part of that plan, and it's the same issue we're looking at for the hospitals as well. The question, the real reality is, especially for young people, children who are in grade school, is the fact that this, the fall is the time when they all get, other diseases, other respiratory diseases. They also get, the flu may come out, at that period of time. I think there's no way to test for everything and look for everything. I think certainly in terms of, the reaction to COVID and what happens in children, it was said by one of the other people, we really don't know. And, the numbers were small, thankfully, in the spring with children affected, but we're going to have to see what happens in the fall. And that's why we really want to reduce the number of cases of COVID. It will be difficult. The child comes in with the sniffles or what sounds like the flu. Could it be COVID? If they can't be tested at that point, they should, go home. They should be evaluated and go home rather than stay in the school. That's why you need a really rigorous plan about what do you do if that child comes in. Because, and they have a fever and they have a little cough and it may have nothing to do with COVID, but we're going to have to be overcautious in this regard because unfortunately we don't have that testing that will tell us right then and there, that minute, what's going on. And even in terms of the hospitals, what we're doing for various viral testing, we're trying to figure out now because this is going to be the same problem in adults. And it'll happen with the teachers and the rest of the staff as well. What we're hopeful is that in Australia right now, thankfully, it's been a very low incidence, low prevalence of flu, probably because everybody's social distancing and wearing masks, and that is very effective for the flu, more effective than it is even with COVID. So we're hoping it'll be a mild flu season, and obviously people should take their flu shots. That would, but for children, it's very hard. They get a lot of respiratory illnesses, as we all know as parents, in the fall, and it's going to be a little hard to differentiate, and that's why, again, knowing that the population has less likely to have COVID makes it easier to deal with that issue.
What you said towards the beginning, that you're trying to keep this as best you can, simple and transparent.
Yes.
So in that vein, and I'm thinking time frame here, because I can hear the parents screaming, roughly when. Let's assume things go swimmingly well, that the mayor and the chancellor this afternoon approve your plan, say, let's move forward. If all those things went into play, when are we talking schools open? Mid-September, October?
I would say exactly what you just said, because we would have to phase it in due to the testing issues at this moment. I would absolutely run a campaign quickly, not just for our members, the teachers, but also for parents to understand that antibody testing is really the better way to go than the COVID test. I would definitely think that we could probably have every school open middle of September to October 1st.
Things went perfectly. Okay. Close to perfect.
Close to perfect. There's no such thing as everything going perfect, especially here in New York City.
Well, we're all humans and none of us are perfect.
Yeah, so. I definitely think we could get that done, but that's going to require that willingness to let's get this done, or I'd prefer to spend our time and effort doing that versus having a political fight. Allison has an online. I'm sorry. Over there.
I have a question about contact tracing. The DOE announced that there will be specific contact tracing teams for schools. And have they given you any more information about that? Did we get an announcement?
No. Well, what we have asked for specifically is that if there is a positive case inside of a school, that the contact tracing for the school community be done within 24 hours. There's more contact tracing to be done outside of the school community, but the first thing that we want to do, because the school is the place that probably has the realistic ability to actually be more damaging for the overall community, what we would like to do is have that contact tracing for the school itself. Who in the school do we need to now quarantine? That contact tracing is done for the school community within 24 hours of a positive test result. Now, we have not received an answer from that, nor a guarantee, and, we're going to give you contact traces and everything's going to be good. This stuff, that doesn't work for us, especially after March. What we saw happen here in March, we're there with you. That doesn't work for us. We need evidence. We need to see it ready to go. We want to, stress test it, which is easily done once we have an ability to say we're all moving in this direction. Allison?
We're now going to go to the folks online. And so I'd like Leslie Brody, if you could unmute yourself and ask your question.
Hi there. Thanks for taking these questions. And pardon this because I've been in and out of this, but it sounds like you're using the word job action as opposed to specifically the word strike.
It's the same thing, actually. Under the law, it's considered any form of a job action. A sick out, it would all be a job action, and it all leads to the same place under the law. The union receiving all sorts of penalties. I go to jail, all of that. That's all fine. We'll do it if we have to.
I see. Thanks. And can you just also verify how, I think you answered this before and I missed it, how long you expect some schools to take to become safe enough in your estimate to enter?
Right now, the realistic expectation is, and this is really sad to say, but we haven't had any in-depth conversations with the city about their largest school district, which is District 75, which is really very troubling to me. We've spoken all about all of the other schools, so they could probably get up and running faster, but the reality is that District 75 schools should be the priority first and foremost. Those schools will need an attention to the level of detail that is much greater in terms of the procedures at the school itself. As you know, those are students, some of our students with really, really great challenges that we love and we're responsible for. Those teachers and staff at the District 75 schools, they consider themselves to be the guardians of those children, and they want to be back in those schools, but that level of building level protocols is going to be much higher. The level of PPE will be much greater, just off of the fact that these are difficult situations, and some of our District 75 sites are almost equal to a hospital situation. So to me, I'd like to shift a lot of focus quickly into the District 75 children, and then, since so much has already been done, and then hopefully we can get them all done and ready to go by the middle of September, beginning of October.
Our next question comes from Sophia Chang. Could you unmute yourself, give your outlet and who you're posing your question to?
Hi, it's Sophia Chang with WNYC in Gothamist.
Hi.
Hi. So I wanted to ask Mr. Mulgrew, so the mayor has said that the UFT has been at the table all along. Why has this gulf happened if that's been true?
We've been at the table all along. Well, we've been at the table by ourselves since April. The city didn't join till July. That's why we have this problem right now. Let's be clear. That's why we're really having this problem right now. I had preliminary discussions with the Department of Education, but from my understanding, but you can ask the city, they really weren't given a green light to start preparing until July. And at that point is when we actually started to engage with City Hall itself. So this union will always do its job in terms of communicating with both the mayor, the Department of Education. That's what we have to do, and now we know that's part of our responsibility. But at the same time, we were very vocal for a period of time about City Hall specifically was not making a good choice by not engaging with us in terms of how to open our schools safely. Yes, Hazel.
Hope we just don't get this conversation that, as my good friend Reverend Foy said, getting up to fight the teachers. It's been more than just the UFT asking City Hall for a plan. It's been community groups. It's been parents. And so the issue here is not who did what. It's what our leadership, our mayor and the chancellor have not answered real specific questions that will make us all work together to make sure that our children, our essential workers, and our teachers go into environments that is safe and healthy and learning environment for our children. That's the real issue here. And I think we should stay focused on what we're saying. If we're going to move forward for opening our schools, we all want our schools open. I think everyone on this meeting this morning said so. But some things have to be answered and put in place. We can't go around it. We can't make it teachers versus City Hall or the community versus the teachers or whatever. The real issue that we want someone to get them from City Hall, the mayor and the chancellor, to say, here's the plan. Let's all sit at the table and work this out. And if we do that, we will be able to open our schools. We don't see September the 10th as being the date. We don't see that we can open all schools at the same time for such a big system as this, but we all want our schools open. We want our children back in a learning environment that is safe and productive. And so that's the real issue. To start with who did what and when, and whether who was at the table. We all have said we haven't been at the table. We haven't been included.
Thank you, Hazel. Well said.
Our next question comes from Henry Goldman. Could you unmute your phone and say who your question is toward and give your outlet?
I think I'm unmuted, am I not?
You are unmuted.
It's good to see you all. I'm with Bloomberg News. I actually have 3 questions that I hope you'll indulge me with.
It depends on how fast they are.
The first one really is, in light of all of the risks, can we really open schools safely in this condition of an epidemic that has asymptomatic spread?
Okay, let's take the first one, since that was one of my first questions, and I've had it answered by the our doctors who have said, yes, it is possible, but they can really get into it.
I think it's possible if you have low community spread, which we do in New York right now, and there is adequate testing, contact tracing, follow-up, isolation, and all these procedures in place, as well as having a physically safe plant with appropriate PPE available and used by everyone, along with social distancing.
Yep. So yes, it can be done. New York City is one of the few places that is qualified at this moment to try to do this. But also New York City is at a high risk, extremely high risk of doing it wrong and paying a major price, which we do not want to happen again.
Okay, thank you for that. My second question goes to the pedagogically. Can in-school instruction really benefit a student any more than remote instruction when you've got the hindrance of the PPE, the masks, the confinement of one room, the physical social distancing, the absence of play?
Yes, I hate to cut you off, but there is nothing, even with all of those obstacles that you have rightfully pointed out, believe me, that relationship between the teacher, the paraprofessional, the guidance counselor, and that student who is in the school building will be enhanced to a better place than if it was just done remotely. What most people don't understand is that the key to great education is the relationship between the teacher and the school community and the student. More than half of our job is getting a student ready to learn. It's not just teaching the content of the subject area. And that is why this is an important challenge that we're trying to meet.
Okay, thank you for that. My third question goes to, there's been a lot of talk about the political motivation of the administration in pushing the school reopening forward. I'd like to hear a little bit more from you about what you think that political motivation would be.
I would kick that to the panelists at this point because my focus is I am not here to discuss or debate about any individual's political motivation. To me, we are in a fight to make sure that our schools are safe, and that if they are safe, we can open them. That's really what my focus is. If that means we have to be in a major political fight, anyone's political motivations are irrelevant. You guys can all write about it and speculate about it. But for us and all the teachers and the parents, that means we're in the streets wearing our mask, fighting with the mayor. But I will kick that over to the people on the panel because I've heard a lot of that from the panelists. They're all looking up. I don't know. Anyone care to just wave your hand? Oh, the political motivation of the mayor is really what the question is. What do we think that is? I said that's not really my focus. My focus is to get the schools open safely. So that's really what the question was. So the 2 thumbs up mean you want to answer it? Nope. Okay. Hazel.
I think we spent time on the real issue here. And the real issue is we want our schools open. We have criterias that we have set out, that we have proposed. The UFT have a plan, the NAACP have a plan that have included parents and other civic organizations. We have Reverend Foy on here. I think that what we need to concentrate on, even the press, the media, is that we have school openings with the criteria that we have laid out. It's not rocket scientists, and we can move on with it. We've spent 1 hour now. We've laid the plan out. They've heard from medical experts, which is very important because we are not medical. That's not a teacher's responsibility. It's not a principal. They are to see that education take place in our learning environments. So I believe that we have put our plan out. We are waiting from our leaders, the mayor and the chancellor, to come back to us so we can all get at a table and get this done.
Michael, let me also say, in other places around the country, people have also changed, meaning that they thought they might have been able to reopen. With all sorts of changing circumstances, including not having the PPE on day one. Cleveland realized that without the PPE, they couldn't reopen. Other places realized with the community spread, they couldn't reopen. So this has been a very changing, dynamic situation. And what many of the doctors have said to us is that you have to be humble about the disease, and it can't be about the headline. You can't be stubborn. You actually have to follow the science, and that what you're doing here is following the science. And one would hope that the mayor is smart enough and is focused enough that the science means more than the headline.
So thank you, Randy. It really is about, I don't want to, I said before, we'll be in a political fight. I really don't want to be in the political fight. I'd rather be in a place where I'm ensuring and we're spending all of our time making sure that everybody is as safe as possible. And it really does come down to, we have independent medical expertise telling us, Hazel, you need to mute. We have independent medical expertise at a very high level, all telling us what we need to do if we're going to do this. After that, I think it's pretty simple that the experts are telling us this is your best shot, especially considering the size of your school system, what has already happened here in New York City. The parents, the elected officials on this call are all saying, yes, we hear this. This isn't Michael Mulgrew's medical opinion. This isn't any elected official's medical opinion. So we're following that guidance. You all know, we could sit here and say, no, we shouldn't open up the schools, but we're trying to put together something that is thoughtful and makes sense, but is also a great challenge. I don't know how many people in the political world get a partner like a union saying, we're doing all this work, we're trying to help, let's get this done. So I'm hoping that, you know, City Hall is listening. I don't know what that is. City Hall is listening, and they'll take us up on this, because if not, then it turns into, I guess, the basic political dramas that we have at the national level and everywhere else in the United States, and that's just not helpful for all the communities and the people involved.
Our next question comes from...
Allison, we got to get like 2 more. I know everybody has
two.
tight schedules.
Yep, the last 2 questions. Jennifer Kane, if you could unmute yourself and ask your question.
Hi, this is actually Jen Pelt from AP. Can you hear me?
Yep.
Great. Mr. Mulgrew, given the totality of what you've been saying today about what would be required, the apparent impossibility of doing that by September 10th, and what the union's prepared to do, are you in fact saying the union is prepared to strike if all the schools open in person on September 10th?
If all the schools open on September 10th and not everything that we just laid out today is not in place, the union is prepared to go to court and or go on strike if we need to, yes.
Okay, thank you.
Thank you. I guess I got to keep saying that to make everybody happy in here. Yeah, yes, yes, yes. All right.
Final question.
I'll get a T-shirt.
Final question from Christina Vega. If you could unmute yourself.
Hi, everybody. Thank you for taking my call. I appreciate it. So I just want to be clear, because we're talking about potential job actions, and then we're talking about citywide testing as well. And so is it fair to assume that, to sum everything up, the UFT is asking for this systemic testing to be in place? It's not likely to happen by September 10th, so therefore you're in fact calling for a delay of the start of school. And if schools are required to reopen and have not met this safety checklist, which it seems like UFT is sending its own folks to double check and make sure these things are happening, that there'll be individualized actions, or can we expect something to happen all across the city, because this testing protocol that you're calling for seems to require a pretty systemic, widespread?
It could be either or. If say September, say we adopt this plan and we move forward, and say on September 21st, the city says we're ready to open every school, and we say no, there's 180 schools that have not met the criteria, then it would be, and you have to understand, under the law, it doesn't matter if we do the whole school system or one school. It's the same thing under the law, that we broke the law. We broke the Taylor law. We're prepared to do either.
Got it.
Okay? All right. So thank you all very much. And I want to thank everybody on the panel for taking the time. And again, I want to thank all of the doctors here who spent probably too much time on the phone with me than they wanted, but I really do appreciate it. So thank you, everyone.